Well, what first stimulated me to become involved in this is, as a physician, I've seen an awful lot of increase in people who are either very, very underserved medically or are literally medically indigent and outside the delivery system. When I became familiar with RAM and got to know Stan Brock better, and he wanted to come to Florida. I was absolutely convinced that we could do a service by bringing this to Florida, and selfishly felt I wanted our community to be the first in Florida to have a program of magnitude like this is. But if you look at what's happening with this, you realize that healthcare is in a tremendous, almost chaotic flux right now, with a paradigm shift from all the legislation and regulations, and it's starting to try to define itself in a more sustainable model. Well, RAM is the nation's largest charitable organization that brings free health clinics to a community by invitation. What we've done in Bradenton is we've mobilized a venue to be at. We've mobilized the healthcare providers, the physicians, the PAs, the nurses, the dentists, the visual specialists and that, and brought all the logistics necessary for a clinic like this to occur. So what we've really done is we've given a vision of how healthcare can couple itself with an organization like RAM, who have the vision of the equipment necessary and bring it in a mobile fashion, the supplies necessary, and a very well-trained team to carry out the event. So it's a perfect, very tangible example of how locally we can be proactive in helping bring healthcare to the needy in our community, realizing that at the present time there's an approximate 43% of our population who are asset limited, income constrained, even though they're working. Well, that's the gap group in our society who need this type of a clinic. So I'm very proud that we've got a huge group of volunteers. This year, over 500 volunteers who have stepped up to participate in making a difference in our community for the health care and the lives of the needy. This year, we've got one dentist who's here from California. Yeah, but what it shows you is the response that can occur with a vision of what can be done. And the biggest thing that leads us to in Florida is the realization that RAM has over 100,000 volunteers who are available to come to Florida and to be helpful in our efforts. Now, having said that, we need legislation in Florida that would allow a professional from another state to come in at their own cost, to volunteer their own services at no fee, and to help us carry these out. Now, if we can get that cooperation from our legislators and get that legislation, I've made the commitment that I will put together the resources adequate to literally create a complete division of RAM in the state of Florida. By doing that, we can have clinics such as this around the state every 3 to 4 weeks throughout the year, serving a great deal more people. And I think Mr. Brock really handles it well when he says, you know, if we come together and treat a patient, we change a life. If we come together and take care of hundreds of patients, we change a community. If we do that one medical RAM clinic at a time, we can change the health care of our nation. And I think he's so correct with that, and we in Manatee County are very committed to demonstrate that leadership in the state of Florida to play our role in trying to create a nicer life, quality of life for people. One of the most important elements of this is to have a venue that's proper and adequate. And over the years, a lot of us have worked with the technical school to where we are selfishly sort of saying we have a world-class technical college in Manatee County, and this is certainly exemplary of it. We have 3 different campuses. We have 52 or 53 centers of excellence of education, and the Manatee Technical College is doing a very, very fine job. Now, you're right when you say it takes a lot of other participation. It takes between $60,000 and $80,000 a year to have a program such as this. We don't accept a thin dime from the government and don't ask them for any money. This is all put together by the gracious donations of people within the community, both individuals and various businesses. And we've got a banner around here that'll show you some of these people. One of the organizations, our various Rotary clubs, have been exceedingly generous in them. The Patterson Foundation is exceedingly generous in helping us with our community corridor as well as other resources, and in their program with United Way concerning reading for children. Well, as you're well aware, my whole life has been healthcare. That's my profession. And what I really love about these clinics is, if you'll notice, every individual that comes through to receive services is treated with graciousness and a lot of respect. And that says a lot for the caringness of our community of professionals who give of their time to take care of these people at absolutely no remuneration to themselves. And further, some of these dentists especially do follow-up care that's very needed after the fact. And we as a community, that's where we as a community need to look at utilizing some of our resources to reimburse them as they go on through the year, giving to these patients that come to the clinic.
You know, here we are for the 3rd time in beautiful Manatee University here. And we've had a good day yesterday. Saw 500 and odd people. Today it's a little bit rainy, but they're out there. Probably got 300 in the door already. Dentistry, vision care, eyeglasses, and also lining people up for spay and neuter programs. And then, of course, there are the doctors treating all the other ailments that people have. Well, you know, we've done, 894 of these operations, of which well over 90% have been here in the United States in the last 32 years. So, unfortunately, there's a great need for what we do here in the United States. Well, my take on whether or not the need is increasing is it's probably pretty stable. We've been doing this here in the United States for 32 years, and the numbers are pretty steady. The problem is that adults in this country cannot get dental care at an affordable rate. They also can't get eye care and a pair of eyeglasses at an affordable way. Unfortunately, the Affordable Care Act, otherwise known as Obamacare, very well intentioned, but it also didn't provide dentistry and vision care for adults. And I don't see any talk of that in the House version and the Senate version. So unless they do something about those 2 key items, we're going to be doing this for years to come. Well, you know, the greatest impediment to what we do, Charles, is that here in the United States, except with a few exceptions, such as the state of Tennessee, doctors are not allowed to cross state lines to provide free care for the underserved. Now, they're trying to move in that direction, I think, here in the state of Florida. And we did get permission to bring one dentist this time, who was a dentist from outside the state. They really need to think seriously about changing the law in Florida to allow doctors to come here strictly for the purpose of providing free care, and not for hanging out a shingle and saying, hey, it's winter, I'm coming to Florida. Well, we've had over 114,000 volunteers in the field during the 30 years that we've been doing this in America. There's a great volunteer spirit in the United States, greater than I've seen in any other country of the world. Got to make it easier, though, for those volunteers to be able to do what they want to do, which is help folks. Well, you know, here in the United States, we've seen hundreds of thousands of patients from coast to coast. And we never have any problem with the patients. The patients are wonderful. In fact, I look on our patients as our friends. And time and again, we'll be seeing patients that we saw last year. They're very, very grateful for what the volunteers do for them. And so it's a wonderful thing. Somebody gets out of the dental chair, they've been relieved of pain, they hug the dentist and the dental assistant, they put on a pair of glasses, they can see the leaves on the trees. It's a wonderful experience for both the volunteers and particularly for the patients. Unfortunately, we're seeing a change in the weather. This is not just a weather pattern. I think it's here to stay. Whether it's something to do with global warming or the ozone layer or whatever it is, the disasters are here to stay. Recently, we've seen Hurricane Harvey, then we saw the big earthquake in Mexico City, and then we were hit with Irma, and now we've been hit with Maria. It's all over the world. And so what I see as an expansion of remote area medical services is we need a large airplane strictly for disaster relief. It stays ready on the runway or just off the runway, full of the kinds of stuff that disasters require. And we can load that airplane with 50 or 60 volunteers, the search and rescue dogs to find people that are trapped in the rubble. We can fill it with firefighters and respond to a big fire in California. We need a large airplane. And you know, all of the airlines are getting rid of the older equipment and buying new. And some of those airlines need to think of disaster relief and maybe assign an airplane to disaster relief or give one to us and we'll take care of the problem. Disasters are here to stay. And look at terrible things happening in places like Yemen, where a child is dying every 10 minutes from cholera and hunger. We need to be on a worldwide basis with this disaster relief program. Well, I'm proud of our volunteers, 114,000 of them, and I'm proud of people like Dr. Richard Conard, who brought us to the state of Florida.
Things are great, even though it's a little bit of a rainy morning. There's a line outside, and we're getting them in as quick as we can and getting served, and some people are even getting double services, so we're very excited about that. Well, as soon as they get their number, they come in and go through the registration process, then their service. They are asked some questions if they're here for dental, medical, or vision. Then we go through, they ask them a few questions for what services they might need, and we take care of business. We have a little bit less than yesterday, but still I think we're going to meet the needs of all the patients that arrive, so we're pretty excited. They are the medical services. They can have a vision exam and they get their glasses same day, so really a nice opportunity for people in the community to come in and get medical and vision and dental services. We have some of our staff and faculty members that come in and volunteer. Some of them are down in the kitchen. We provide breakfast and lunch for not only the volunteers but also for our patients today. We have a number of dental students. We have some of the students from our vision program that come and volunteer. So everywhere we can, we've plugged them in. If they're from other programs, they're helping with food service or they help with registration. Vision and dental and some of the medical are not covered by a lot of typical insurance companies, so it's really important that we meet the needs of the community with the dental and the vision coverage. Those a lot of times are extras, and so people go without. So we feel like it's a great opportunity for the community to come in and be served.
I'm doing triage, their blood pressure, vital signs, and doing a short, brief medical history and dental history. And then I refer them on to their particular areas where they're needed care. I think it's very good. I have a public health nursing background, and it's very interesting for the community. Mainly, they're very interested in the care that they're about to receive, and they really don't have much of a medical care program, so this helps them in their hopefully help them in their care. Through one of my nursing students that I teach at school, and she was here yesterday, and very enjoyable. And hopefully, I can bring more students here next year when they return.
Well, last year we actually treated animals at the Braden River High School. We had veterinarians there and technicians, and we treated a lot of cats and dogs. Because of Hurricane Irma, they weren't able to schedule all the veterinarians, so we're handing out vouchers to people that come by. They go either to the Humane Society or Animal Rescue Coalition down in Sarasota, so they get the rabies and their vaccine shots. So people want to breed pets because they're so cute, but there's plenty of pets out there. They don't need to be bred, so they're really pushing the spay and neuter program. Yeah, word got out this year that we're not having the actual veterinarian clinic. I think we're up to about 180 or so people that have come by and gotten vouchers. We had, I think, close to 500 last year that actually came through the program. So word got out, but we're handing out plenty of vouchers, and that's what I'm here with some volunteers today. We're walking through the crowd to see if we can help people out. But there was a chance again to help out with the community. I walked up to one of the people I work with, Sue Colty, and said, well, what can I do, Sue? I'm not a veterinarian, but what can I do? So she stuck me out front, and I started signing people up. So I stayed out there all day last year, and now I'm still with them and helping them out. So it's a good group. Well, there obviously is a need. And this isn't just people in our area, this is people from outside the area that are coming in as well. I mean, healthcare is a big problem in our country. It shouldn't be in the state that it's in, but we won't go there. But it shows you the value of these types of programs. And I commend RAM Group for putting this on and coming down here and helping us out. It's very nice of them to do that. Just look up RAM on the Remote Area Medical on Google or whatever. There's a sign-up sheet. They want you to sign up because there's some liability issues. But and there's plenty of other places you can go besides just the Sarasota-Bradenton area. They go all over the country. So if you have plenty of time, you want to help out, just sign up, and I'm sure they'll find you something to do.
I actually am a retired RN now from Fort Myers, but I was a nurse for 43 years, just retired, and I want to volunteer my time. I go on other mission trips, and I wanted to check out RAM. Well, I talked to a friend not too long ago that had volunteered for RAM, and I was checking out their website, and I knew that there was going to be a clinic close to my home, so I wanted to see how well organized they were and what services they provided. So I volunteered to come up here because I'd like to volunteer again in other states and areas. Oh, I think they're extremely well organized just to bring in so many people, and I know what it's like to transport all this equipment, and they're just an amazing group. Well, I'm working in triage today, people that have been waiting in their cars all night, a lot of them, and they come in and we get a health history from them and take their vital signs and maybe order some tests like blood sugars and tell them all the things that we offer here at the clinic. Well, some of them have gotten some health care, but a lot of them aren't getting health care on a regular basis because it's so expensive, or they just don't have a doctor. We usually tell them, that they're offering flu shots and HIV testing, and you can even get your pet taken care of, there's just a lot of resources here. It's amazing. Well, I just think it's great that so many people want to come and help, and I look at all the people that are just directing people around, and then we have all these translators, which we couldn't function without them, and then all the nursing and medical people, and it takes a lot for you to give your days off to come up here and work, and it's very rewarding, though. I enjoy it. Oh, I think that if anybody's interested in this, just go on the ram.org website, check out what clinics they have available, and there's a need for everybody. You just don't have to be a medical person. If you're willing to help and help other people, they will put you to work if you volunteer.
My name is Stephanie McDonald. I found out about RAM through my club, Pre-Soma, at the University of Central Florida, and we're just here to volunteer, so.
Yeah, my name is Anissa Molvichidi, and we're really excited to be here. It's been a complete eye-opener, seeing all the people that need the health care, and how it's amazing all these people came out super early to just volunteer their time and their services to all these people in need.
I've been here for 2 days. Yesterday I was working over in triage, running patients back and forth, and today I'm over in the dental clinic area, which is really, really cool.
Yes, I was in registration, so just helping with the patient flow, and then today as well helping with patient flow, getting them to their chairs where they need to be, and making sure everything runs smoothly. Well, we're not so into the medical aspects of this, so it's really nice to be able to help those dentists and doctors and nurses that all took their time out of their busy lives to come and help. So just to be able to just help them in patient flow or just whatever they need to make it easier for them is just really rewarding, I feel.
I'm not gonna lie, it was definitely hard to wake up early for this, but it's really great to see everyone putting their minds together to work towards a common goal, and that's to serve this area. So it's really, really great. They're definitely grateful. I've been getting thank yous, have a nice day, I'll ask them how are you, and they'll just tell me about their day, and it's really, really awesome. Mainly thank you, though. They're pretty grateful.
Like Stephanie said earlier, they seem more chipper than a lot of the volunteers. They're in a great mood. They're just happy to be here, happy to get this chance, and they're just all really happy in a great mood. I would have to say that it's very rewarding. You feel good about yourself, and it's just an eye-opener, and you get to see something different that you don't see on campus or you don't see around, and it makes you appreciate what you have, and so to be able to give up your time to help someone else that doesn't have that, it's rewarding.
I'd say get involved. Honestly, I didn't think that I would be so involved in the community until I actually joined my club, and honestly, just join a club and you'll make more of a difference than you believe you will.
Dr. Connard was in our Rotary Club in Palmetto, and I'm a member of the same club, and I'm a dentist in Palmetto, and he suggested that it might be something that I might like if we get involved in treating people who are less fortunate, that have no financial wherewithal to get their teeth fixed. And so I came 3 years ago, and this is my third year. Yeah, I enjoy doing this. This is a great way to give back to the community. Unfortunately, people tend to put off getting their teeth fixed until they get into a bad situation, and then they get in a situation where they need something done immediately, and it's expensive. So this is great that we're able to offer them a chance to come in and get something done like this, and the dental needs are significant in our community, and so this is great that we're able to treat these people. Yeah, it does. And I've spoken to many of my colleagues about working this clinic, and it's a challenge, but it's something that once you give it a chance and give it a try, once you do it a few times, you get to the point where you get more out of it than you serve others. Actually, it works for you too. Well, typically in this environment, we can basically just do pain control. For instance, people that need teeth extracted, that are in pain, we're able to do that. Pretty much a wide variety of dental surgeries. Restorative dentistry is a little more challenging in this scenario, but we do a few fillings from time to time. We can do fillings. More complicated procedures like crowns and root canals we're not able to do in this environment. But we can usually get them referred out into the community, and I've seen a few in my office that were able to have procedures done that we couldn't do here. Yes. Yeah, it's hard to say. I mean, this is my third year, and I know several hundred will go through today, a couple hundred at least, and it's pretty impressive. I think you'll see close to 200 for sure, and they track the amount of procedures that we get done, and it's great. It's great to like to be able to serve more. Well, I would say, first of all, look at your schedule in advance. They'll be able to tell us when they're coming back next year. Try to reserve this weekend, and give it a chance. You may find that you get a lot out of it yourself, and I get a lot of satisfaction. I know you will too.
Dentistry is often quite involved in community service. And these students, while they're in school, get to see what we as dentists do for the community that we're so dependent on. And we have 10 students coming in each session. So we have 10 this morning, 10 different students tomorrow, this afternoon. And yesterday we had a total of 20 also. And what's interesting is some of these students, this is more than their first year here. I know it's my third year. Dr. Evans, it's his second year. And we have several graduates of the school that are now volunteer dentists here. So it's kind of nice to see our former students.
Well, there's also some factor that they can gain by looking at these people. When you're taking students from LECOM, we take a certain type of patient. They could be a teaching or instructing patient. You know, we're not clinical set. However, the kind of patients they get to see here are going to be the real world types of patients that they see. So to have that as part of their experience, I think is very important too. You know, and then it kind of tempers what they're learning in school.
Well, one of the things I was going to say is our students are getting to work with licensed dentists, and they're able to see the techniques that these dentists have learned over the years, and they will take these techniques back to the clinic and utilize them as part of their learning experience. So this is not only community service, but it's a great learning experience for our students. Dentistry nowadays is a luxury. What should be a necessity and part of your normal health routine, to a lot of people, especially in this economy, it's a luxury. So the cost of dental care is quite expensive. This is why we see so many patients at our school, because our fees are lower than in the general public. And of course here, it's done free of charge. And we've seen even patients who come to our school come here for some extractions, for instance, just to save money. So, this program is quite beneficial to the community.
Well, my take on it is pretty much is why we don't get to see as many people in dentistry. You know, we're associated with pain more than anything else. People come to see dentists because they want to relieve pain on here. If they don't have pain, they still can have dental diseases that need to be treatment, but it doesn't take the priority that maybe the medical field or a medical problem could have. So I think that's one of the reasons why people aren't seeking the care unless they need to, because there's a lot of unmet dental needs out there where people need work. And like we were saying on here, where it's at LECOM or even at a RAM event, you find out what your area is really needing as far as dental needs.
Well, it is state of the art. We have 10 D3, which is third-year dental student clinics. We also have a 15-chair clinic, which is used for our residency program, and also other instruction for our students, D1s through 3. Like I said, it's a top-notch facility. We've graduated 2 classes, so we've been around teaching for 6 years now, and when people come to our school, they're quite impressed.
Yeah, it definitely is the state-of-art type of facility on that thing. Each individual student truly has his own operatory, and it kind of simulates what he's going to do in the future when he does graduate. But in addition to just materials, the way they're taught too are PBL courses, which is problem-based learning, puts them in groups where they learn to converse with each other and come to a solution to a problem, which is something we don't do in most dental schools that I've ever been associated with. So I think that combined with the background and also the types of equipment and facilities we have, it really surprised me quite a bit. I'm just glad I can be part of the instructing in that kind of institution.
Our success is dependent on the community. And because of that, and we do have very nice lives compared to most people, we in the profession should give back to the community that gives so much to us in our practices.
Well, I think participating in this shows a lot of character of the types of students that come here too. Dentistry as a whole has given out quite a lot of free dentistry, not just this kind of RAM event. Mission Immersory or moms that have been coming up, Project Christmas Smile, Give Kids a Smile. These are programs that are nationwide as far as statewide. So we try to provide for the people who need this type of treatment, who may not be able to get it any other way.
We have a dental hygiene program. We accept students every March of each year. We take 14 students. So we currently have 28 students in the program, and the program has been in existence since 1999. It's a great opportunity to be involved with remote area medical because you can give back to the community. There's not many opportunities to give back in this scope as far as treating as many people as we do here. We can give back at small events, but this is a very large venue where we get to treat a large number of people. And this is the 3rd year that I have participated. This is the 3rd day this weekend. We actually help with setup as well on Friday when they come. So it's a very rewarding opportunity. We actually are all in dental within the family. So I'm a dental hygienist. My middle sister is an assistant, and Kendall, who is my baby sister, youngest sister, she's aspiring to be a dentist. So she wanted to come along to volunteer and help out as well. It is a very well-oiled machine, and RAM does a phenomenal job as far as coming in, setting up, getting everything prepared. I think as far as the numbers of patients, we do have a tendency to increase, and it's just we need to do better probably as far as getting the word out to patients, because we do have so many providers who do want to give back to the community, and I don't know that we do as good of a job as we can as far as getting the word out, but it's been very nice, and the numbers are growing. We do have a great need for dental health, and what we find a lot of times with patients is they can be employed full-time and they have health insurance, but they lack dental insurance because that's a separate component as far as their insurance is concerned. And then they may not have the funds, even if they have insurance, to get the restorative care they need because it's rather expensive. So actually this year we saw many patients coming back for treatment who had been here last year, even for cleanings. They had cleanings last year and they were coming back this year. So it's pretty amazing.
Yeah, I think it's a great opportunity, and it's really, truly amazing to see how many people come in and need dental care, and being able to provide dental care to people that need it is very rewarding.
The dental hygiene program information regarding that can be found on the SCF website. So it's scf.edu, and we have a dental hygiene page, so you can go to the search bar, type in dental hygiene, and everything related to dental hygiene would pull up. It covers the courses that are required, prerequisites that are needed prior to getting into the program, the length of the program, cost associated with the program, and then also the registration process and when we actually admit students.
Our community has a lot of people that don't have health insurance, and this is a great place to come and not have to worry about expenses and everything. And I think it's definitely a need. So we're all RNs currently. So we are going for our bachelor's degree. So it focuses a lot on the community, and it helps us get the full picture of what our community needs as far as medical services, and we're able to provide not only medical services, but like what we have here today which is promoting physical activity, and so it just helps us to be prepared for the community end of the nursing. Yeah, well, for one, some people just don't know. I mean, they were raised, maybe inside, sitting on a couch, so their children are essentially going to be raised the same way. Also, technology, of course, you get them stuck on their iPhones and their iPads, and even it's starting younger and younger. We see it in our very young children that are glued to their iPads and stuff. So we're just encouraging people to get up and get out, and even if you're playing inside, just as long as you're moving. And I would suggest calling. They have a great admissions department. You could even go there if you'd like. There's people there that can guide you financially. There's plenty of scholarships and things if that's what you're afraid of. But I would just make the call and really look into it. And there's also information online, but talking to someone will definitely get your foot in the door. I think it's just very needed, and I think that it's making a huge difference in a lot of these people's lives.
My name's Komal Patel. I'm an occupational/ER physician, and I'm here today to just kind of help people who have not been able to get help in other means, and to kind of give back to the community as well.
I'm a FSU DNP nurse practitioner student from Florida State University.
I'm Susan Horton, a FSU DNP student from FSU University, and excited about being here.
And I'm Elizabeth Burke. I'm an undergrad at the University of Tampa, Bio Pre-Med.
I think it's important, just being a healthcare provider, to be able to give back to the community that you work in. And sometimes you don't get to have these opportunities when you're in private practice, but when you're here, you kind of feel like connected to people that you normally don't see.
I think in healthcare, we know there's a problem until you see the magnitude of the problem with the gathering of the people here in need. It changes your perspective of helping people.
I think it's all about giving back, helping as many people as we can, especially when there's a need for it.
This is my community, born and raised, Sarasota, live in Bradenton currently, but these are the people that my kids go to school with. It's their parents. So it's just a great opportunity to be able to give back to the community, to network with other providers. So just really happy to be here.
I think it seems mostly the common problems that we've been seeing are, influenza, diabetes, high blood pressure, some things that are chronic. And just to get insight into how, like you mentioned, like how they have come so far, they've slept overnight, is kind of opened your eyes to how there's a disparity of what we have and what we don't have in the communities, and that's been kind of eye-opening for me. You also get to see people in their own community, so we kind of are in an environment where they can feel like they can come to us, as opposed to them coming to the hospital or coming to the ER. So it's a little different, but it's nice to see everybody working together here to kind of make everyone feel accepted.
The most important thing is, having all these people who, are taking time out of their weekend. I talked to one neurologist who's traveled down from South Carolina, to be here. So people are, really wanting to help, and it's good to see that, that we're not just, this isn't just a business, like healthcare often is. So it's just been a really great experience.
It's been a great experience so far, just seeing that how people feel so grateful to be here, both volunteers and even the patients that we're seeing. So it's been a really great experience. I would say definitely jump in. I think that there's so much opportunity here. Like we were talking about, there's neurologists here, but it'd be great to have other subspecialists to give back to the community and to basically be a person that people can turn to.
Sure. My name's Ben. I'm a first-year medical student at LECOM Bradenton, and I am here because I wanted to get some volunteer hours and interact with some patients in a clinic setting.
My name's Brandon. I'm a third-year medical student from LECOM. I'm doing rotations at St. Pete General Hospital right now. I came down here just to get some patient experience and just, really be able to help some people out for free and that really need it and can't afford it, It's a really cool thing to be able to bring all of this from city to city. I think they bring a lot of volunteers with them, but they're always able to just pick up many, many volunteers. It's a very cool thing.
I think it's laid out pretty nicely. It's great that patients are able to come here, get vision work, get dental work, and also get free medical care and get referred out if need be for further testing. We just had a patient come in with some neurological type symptoms, and we had a neurologist on site that was able to help treat her and diagnose her and giving her some referrals to additional services in the community. We had a fracture yesterday. Quite a bit of just people coming in, general workups, OB health. It's been a great experience.
Really, I think they just need to realize that a lot of the patients we're seeing here, they have chronic medical conditions and they're just not able to afford to go see a doctor, and that's why we're seeing them here today. And it would be great if they could, come and help us all out and see these patients who really just can't come in before these conditions get worse.
So today, patients are getting their glasses prescription checked. They're able to choose glasses, and they're also getting their health checked. So dilation, glaucoma testing, all of that as well. So we're able to provide patients with glasses, especially for driving, reading, patients that lost their glasses recently or they broke. So patients are being dilated and they're being checked for cataracts, those types of things. They can see so much better with the glasses. So once they get them, they'll be seeing much better. Just to be able to help their kids, see their kids, help them with homework, things like that. It's very important to get your eyes checked at least once every 1 to 2 years, because not only are we checking for glasses, but we're also checking your eye health, checking for glaucoma, cataracts, and all of that as well. This event is great. It's helping hundreds of patients get glasses and have their eye health checked. So it's very important because not everybody can afford to see their eye doctor or can afford a new pair of glasses.
Unlike other programs where they have to use multiple buildings, everything here is under one roof. So patients come in on one side of the building, they get triaged, they find out if they're going to be for dental or medical or vision, and then they're automatically brought through the building. So it is nice that we're all self-contained here. And the nice thing is we do have food on site. We are providing lunches for the patients and for the volunteers. We had breakfast this morning starting at 5 o'clock in the morning for all the patients also as well on site. So it really is a great location for people to have this type of program here. For our dental assisting program, we have many of our students here out on the floor helping with the dentist. Optometric assisting, we have all the optometric assisting students here in the back, and they're also making the lenses today as well in the semi that's out parked beside us. This is one of many, and really we have a community event here about once a week here at Manatee Technical College. It's a great way for the community to see what we have, and we're happy to do this. You know, Manatee Technical College wants to give back to the community, so we're here to help the community. We're here to meet our local workforce demands as well. There's well over 1,000 volunteers. There's staff from Tennessee, from the RAM organization, who's been down here working tirelessly for 3 days, and then after this is over, and this will probably wrap up later this afternoon, they have to put everything back together again because we have class Monday morning. So everybody here gets the credit. They are the heroes. The doctors who are here, the nurses, all the healthcare professionals. This works because everybody is chipping in, making it happen. So Manatee Technical College is the largest technical college in the state of Florida based on the number of programs that we offer. So we have over 50 programs here at Manatee Technical College. Most of our programs are about a year long, and so we want students to come here. If they haven't been here before, come here, take a tour, see what we have to offer, because there are so many open jobs here in the Sarasota-Manatee area. We are here to be a staple in this community. We want the community to come here not just for education, but for all community events. We're happy to serve our community, and it's a great place to work and be educated here at Manatee Technical College.
It's been a little bit of a challenge. There are a lot of other dental events that dentists in the community participate in. We had the Christmas in August that the Kiwanis puts together that we had dentists volunteer for, and we appreciate all those who do come out in the community and participate. Our Dental Society does a separate one. Dr. Hygiene with Manatee Dental Society coordinates with MTC to do a portion of school kids with that. But this is a very special, unique event, and it's a phenomenal asset to the community that this is the first one in Florida. It is up and running. The type of facility is impressive that you take a facility like MTC and convert it so dynamically into a multi-function dental facility along with all the other services that are offered on site.
Well, we're in the dental triage, and once the patients come in, then we see whether they need a filling, an extraction, or a cleaning, and then we direct them to the respective services, whichever they require. This is actually my first RAM event, and I think it's wonderful, and I'm so glad I did. The amount of people that we've helped and just how long the people have waited just to be seen is incredible, and it shows the need for these types of events to occur even more, especially here in this community. The need for this is so great, and I think, and if it's obviously feels great to give back to the community, and I would definitely recommend and suggest to fellow dentists and other people in the dental profession to come here and volunteer.
It would be great if we had even more dental care people, dentists, hygienists, assistants, to facilitate the care, because there's still, at the end of the day, there will be people left untreated that would have loved to have had some treatment, and it's a shame that that's not available to them, given that we have all the potential equipment and everything to make that work. My hat's off to Dr. Conard for having originated this. RAM is certainly all over America. You're well aware of all that it has done around the country and overseas. But to bring it to Manatee County, to service the west coast of Florida, is a phenomenal asset. And I think to the people who are being served, getting out of pain, getting some things done, getting care that many of these would never see the typical dental office in the community. They truly need this type of service to them, and we have great facilities with Rural Health and Turning Points and others in the community, but this to get the number of people showing up that we get for this event. Obviously, there's an unmet need, and it's great that we've had the support that we've had for this, and I would certainly encourage all the dentists and dental hygienists in the community to view all this, step up and become involved. I think those who have been involved in the dental community are basically leadership people in the dental community. They're the ones who most acknowledge and appreciate what the community has given them and what they're able to give back in time and intellect in their service to the community. We appreciate that and would love to see more out in future years. It's always a challenge because the first year was kind of a new idea, new concept, and it seemed like something from outside. It wasn't a local involved activity. So it's taken time to get the experience. Those who've come here and worked, we've got some great oral surgeons and general dentists and pediatric dentists from the community that have come in and have been phenomenal in their experience. And for some, it's a great opportunity to see things they don't normally see in their office, to take advantage of their skill sets to be highly efficient for these individuals who really need some good care, and they're getting it.
They are so appreciative and so grateful, and I was very moved by some of the people I met yesterday, people who've been waiting, who slept in the parking lot just so they could be seen today. And so I feel very I'm very thankful to give back to them, and they have been very grateful too, and I'm glad that we have this platform and this opportunity to be able to do this for them.
Just to note, we've had some that tell us about being in the parking lot, sleeping overnight in their car to get service here,